record. Thank you very much, all of you, for being here today. I hope that we will give good and useful information for all of you. Before I start, I would like to announce or to highlight that the B2B meetings are still to be booked. That will be very useful for you. So please feel free to book it on the B2Mats platform, okay? And with that, let's begin with the presentation. Rosabella, can you put the presentation on, please?
Can everyone hear me and see me?
Yes.
Okay.
Wait.
Okay. Good afternoon, everyone, and welcome to Nordic Access webinar, Explore Pilot and Testing Opportunities for HealthTech and MedTech companies in the Nordic region. We are thrilled to have you, each and every one of you, joining us today from different parts of the world. So my name is Rosabella Singh, and I work as a project manager in AARHUS. We are a management consulting company based in Lappeenranta, Finland, and I'm also a project manager of Project Nordic Access. Before we dive into detail, let me take a moment to thank you, Desire team, for hosting this joint webinar, and also Pablo and Pascal for coordinating in this process, and my partners, of course, who made this event possible. All right, so let me quickly provide you the highlights before we move towards the presentation. So what you can expect from today's webinar is we will be presenting Nordic Access, and then we have CEO and senior consultant of AARHUS, Jukka Niiranen, who will be sharing the healthcare in Nordics with some facts and figures. And then we have Anna Kalin, who is joining all the way from AARHUS, Denmark, and she will be presenting the product testing in Denmark and with some examples of the current collaborations. After that, we have Mikkel, who will give us a tour to AARHUS innovation ecosystem, and we have Kent, who is joining from Reason Västerbotten, Sweden, who will be providing some of the current projects of Reason Västerbotten. And we have allocated 1 hour for a B2B one-to-one session, where we expect you to answer all the queries you have regarding our project Nordic Access, and also if you're interested to know more about Nordic healthcare landscape. So please allow me to present Nordic Access. So we are a one-stop funnel that connects companies with testing partners, and we are a consortium consists of 3 partners from 3 different Nordic countries. We have AARHUS Denmark, we have Reason Västerbotten, and we have AARHUS Finland. So together we are creating a one-stop funnel, a process or a streamlined funnel tool that will connect companies to get their testing done in the Nordic region. And it's co-financed by Nordic Innovation, and we will be up running for the next 3 years. The project started in 2022, and we started with a qualitative study asking about the experiences and the practices of the testing of the healthcare companies and the testbed, and that's how we started building the comprehensive screening and evaluation method, which we have named Nordic Access. And I think it's a very proud moment for the whole team that we have already tested or we have tried our model among 25 companies with a very good feedback and a long way to go. And where 2024 seems to be very much interesting for us, because this is the time of the year, I would say, where we will be implementing among additional 100 companies, and for sure we will also make it commercially available by spring 2024. So what is one-stop funnel? What is Nordic Access funnel step look like? So it's not very extraordinary, but it's very standardized process, I would say. So as a preliminary step, a company who is interested to participate in this process needs to prepare the pitch deck, and we have already defined template, which will definitely ask question about your company, your testing need, and your technology in the big picture. Then after submission of the pitch deck, the company is invited to participate in the vote session, which is the vote session is most popular among companies based on 25 feedback we have received from 25 participants. So it's a very interactive section where we go through the each dimension of the technology, and also we go through the technology readiness level and the innovation readiness level itself to see where the companies stand in terms of technology and to verify the tech testing need as well. After that, we have an internal discussion where all the experts with their expertise come to the table and give their feedback, and based on the testing needs and what kind of technological components they have, we come up with recommendations where we point companies to two testing partners which we consider as the best testing partner to reach out. And that's actually in the form of a document which we have named report card. And this is the final outcome of the project, where we will be not just mention the name of the testbed, but we will be also mention the contact point of the testbed. So when I say board session, it's really, really important for me to also share who are the board participants, who are the experts behind the whole process. So the board participants consist of Jukka Nilanen, who has nearly 25 years of work experience in the business development, and he's also part of Finnish Business Angels Association. And then we have Anna Karin. She almost have a decade experience in the project management and have been a project leader in different EU projects. We have Kent Soderstrom, who is already an expert in the telecom, and he had previously managerial role in the digital transformation for 2 out of 6 healthcare areas in the region Västerbotten. And we have Mikkel Svin, who is already a welfare technology consultant. So these experts bring their expertise and competence and help us to put the information into the table to provide the right guidance, and also the constructive feedback to help companies to find the right testing partner. That's what we are working in this funnel. And if you must be wondering who can participate in this project, so the companies has to be in the HealthTech and MedTech, and you need to have testing need. It does not matter what kind of product life cycle you are in. You could be in the very initial stage where you need to validate your idea. You could be in the prototype stage already and you need to do some clinical trials, or you already have a finished product and you're preparing for the market. So any company with any product life cycle can actually participate in our project. And also it could be very interesting for companies, especially located outside Nordic region, who would be very much interested to explore Nordic market and how does the whole system work. So it could be a very good platform for you to test the market feasibility for your product. And just to let you know that we are open to all the companies of all sizes and country of origin. Okay, and why should you participate? Why Nordic Access? Of course, the funnel that I just presented not that long ago gives you some sort of idea that we have a standardized process that help you to streamline your testing needs and communicate your testing needs in a perfect manner, so that the test bed or the testing partner will understand what are you aiming for. And also we make sure that your testing goal is aligned with your business goal, so that any testing will lead you to the commercial success. And then also let me bring this to the table that any test bed who are working under municipalities, they are resource limited. And even though they support innovations, they may not have the capability to support technology in a good pace of time. So in that context, we are also acting as a bridge between the municipalities test bed and the healthy companies to connect. This is one of the best way of connecting these two actors who are the biggest players in Nordic market. And of course, Nordic healthcare is well renowned in the market with this excellence, and also they are the early adopters of new technologies and treatments. So every technologies are considered and you will test in the Nordic quality. Okay, proudly presenting you the participants who has been through the Nordic Access so far, and the number will be increasing in the future. So this is our journey so far. And if you think like you are looking for testing opportunities and you've been thinking or you don't know how to start, you know whom to contact, you can easily reach out to me through this email address that I've shared with you on screen. Also, you can visit our website for more information, and we will be happy to help you in every possible way. And also one-to-one session is already there to have more information. I thank you everyone for joining us one more time, and I wish you a wonderful and interesting time with us for the next couple of minutes. Thank you.
Thank you, Rosabella. Let me quickly introduce the Desire project, because I just forgot right at the beginning to introduce. Or maybe I will introduce it at the end, Rosabella. Fine, sorry.
Hey, go ahead. You can take a moment, of course. Shall I stop sharing?
Sure, that would be awesome. And sorry, I hope that you can see my screen now. Can you? Perfect.
Yes.
So I just wanted to quickly introduce the project that is in collaboration with Rosabella's project. So it's called Desire. It's basically the development of e-health solutions, improving resilience in Europe, and it will last from September 23 to August 25. It's basically composed, or well, the main goal is actually to support SMEs in the e-health and digital health markets to facilitate the access, but also to support the green and digital transition. We have so far 5 partners from 4 different countries. So Interizon in Poland, they include IT from Romania, Eurobiomed from France, and then we have 2 in Austria. Human.technology Styria, and ETS, so International Center for Steiermark. And basically the services that we provide is just, we have a platform for all relevant actors here. So we bring them in contact, then we definitely make different events. 12 are planned so far, and consultation meetings, trainings. The funding that we offer is for 35 SMEs with a maximum of 30,000 euros per SME. So the call is open from the 13th of September until the 13th of November. And it will be in order to promote the product innovations for new products or services on the companies, in order to promote the business process innovations, but also internationalization. And that was all from my side. Sorry, Yuka, you can keep on now.
All right, thank you.
Mm-hmm.
Okay, hello everyone. I hope you can hear me also.
Yes, we do.
All right, excellent. Thank you. So my topic here is, well, first of all, my name is Jukka Niiranen. I represent Arnora Oy. Arnora is one of the partners in the Nordic Access project. And my topic today is to understand healthcare in Nordics. I will be going through Finland, Sweden, and Denmark because the time limits and because these 3 countries are especially present in this project. But first of all, just very quickly and very briefly, a couple of words about Arnora. So we are a high technology business consulting company. and we are specialized in ICT as well as health technology. We have basically three main areas where we operate. Facilitating innovation, that's sort of kicking the startup companies into their butt so that they actually can get their business running. There's all sorts of plans, market entry stuff. That's about it. Then, of course, the business development, that's every consulting company's bread and butter. There, our customers are mainly growth companies and public sector organizations who are either building or pushing forwards their projects. Thirdly, nurturing health tech, so acting as a additional hand when ICT companies, health tech companies are putting their innovations forwards in the field of health tech. What sort of combines all areas is that there's always high technology ICT involved. Okay, then to the actual topic. So first of all, in alphabetical order, we have Denmark. And Denmark is about 5.8 million person market altogether. And the country is divided into 5 regions, which we can see on the map here. And us in Finland and Sweden also, the healthcare services are provided mainly for free and financed by taxes. So the main things Denmark always underlines is coverage, free access, and decentralization in their healthcare providing system. The entire system is divided into 3 levels. The state takes care of the overall regulatory and supervising functions, does the legislation and so on, as the job of the state normally is. The main healthcare is then done on these 2 levels. So in these 5 regions on the map and in the 98 municipalities locally. The regions are taking care of hospital care especially and about contracting and appointing the general practitioners to the public. The entry point for public is the general practitioners, so basically like a own doctor system. The healthcare is provided by public sector and the private sector is then used as a resource. And the municipalities, on their behalf, they take care mainly of primary health and social services, rehabilitation, and such. The areas in the country are pretty much same size, of course. The capital region and central Denmark are the biggest one, as well as the southern bits. Northern Denmark and Zealand area are tiny bit smaller. Next one is Finland, and the big thing in Finland is the well-being service counties. So Finland has actually just finalized a reform in the healthcare system, and in the reform, which actually started from 1st of January this year, all healthcare, social welfare, and rescue services were combined under these 21 self-governing well-being service counties. The term is hyvinvointialue in Finnish language. So these well-being counties, they are in the focal nowadays. So mainly they were formed joining nearby regions or provinces together into one service county. The only exceptions were city of Helsinki, which is the capital, and the Ahvenanmaa Islands next to Sweden. They provide their own services still. In addition to the well-being services counties, we have in Finland 5 collaborative areas which are gathered around the university hospitals. The university hospital cities are marked here in red. So each collaborative area has certain number of these well-being service counties in it. Like in Denmark, healthcare services are provided free of charge. Public sector is in key role, and private sector is acting as a supplier for public sector when they need it. And as a side note, perhaps a little bit, despite of all good intentions, the reform that just took place, actually it was planned for I think like 15 years or something, but still it was way too much focused on administrative work, and especially at the end it was highly politicized. So actually they are now discussing about the next reform. Excellent. But it's done, it's running. The good thing is that maybe in 6 months' time or years' time, the new well-being counties will be actually able to even purchase some services from companies. And finally, Sweden. So Sweden is planning a reform to reinforce the primary care, and healthcare in Sweden is decentralized, and the responsibility is especially in the regional councils. Regional councils are described here on the map, and the biggest ones are the Stockholm area, Skåne, and Västra Götaland, with about 2 million there, and 1.37 in Skåne. Other ones are little smaller ones. So just as in Denmark and Finland, the central government, of course, takes care of the principles and guidelines and guiding of the high-level work, while regional councils have the primary responsibility for providing health and medical services. And the regional councils can also decide to purchase services from private healthcare service providers if that is seen as necessary. Municipalities then take care of the mainly like disabled, home health care of elderly and nursing homes, also some psychological disorders and people released from hospital care, and school health care is taken care by the municipalities, but regional councils are in the focal. That actually concludes the very brief presentation of the Nordic countries. Now, next one is Anna-Karin.
Thank you, Jukka. Will you change to my presentation?
Yes, just a second. I'll stop this because I'll stop the presentation for a moment because I can't mute myself without if that's running. Try.
Thank you.
There you go.
Great, thank you. I'll start then. Hello, my name is Anna-Karin Johansen. I am a project manager in the municipality of Aarhus in the Department of Assisted Living Technology, which is a part of the health and care section in Aarhus municipality. In the Assisted Living Technology department, we work with testing and implementation of assisted living technologies. I'm supposed to tell you a little about how the testing takes place, the testing processes in Aarhus. But first, a few key figures. Aarhus municipality is the second largest municipality in Denmark with 350,000 citizens. 6,500 residents in Aarhus receive assistance in their own homes. There are 51 care homes with space for 2,300 residents. And there are 50,000 assisted living technologies and aids distributed among 27,000 citizens. And we have more than 7,000 employees in health and care. With this size, being this such a large municipality, we receive quite a lot of requests from companies that are interested in collaborating with the municipality of Aarhus and getting their products tested within the municipality. We have therefore created a single entry point for companies, just for the health and care section. If you are interested in testing in other areas, for example, in the area of youth, for example, or psychiatrics, then that will be another department. But within health and care, we have a single entry point. And we receive all the inquiries through our website. There's a formula that you as a company fill out with the information about your company, about your product, and your interests in collaborating with the municipality. Once a month, we have a panel that meets, discuss, and take a look at all the inquiries. And if the panel's interest is caught, they will forward the inquiry to an employee in the department who has the skill set to assess the specific company products and to recommend the next step. It is completely up to the municipality to decide if there's potential for collaboration, and so if so, what opportunities the municipality can offer the company. And if the company, it's important to say that if the company is offered a collaboration, for example, a user test, then as a rule, the collaboration ends after the test. So the company is not entitled to any further treatment or collaboration if they want to try and sell the product to the municipality. Then that's a completely new process. But we do offer different cooperation opportunities. First of all, there's testing, in actual testing within the municipality, in either. Let me just see if I'm up to on speed of all the of the slides. Yes, that looks right. Thank you. The company has the opportunity to test a product in nursing homes, in health home care teams, or within rehabilitation centers. The company itself may have to bear the cost of paying for the time that the municipality employees use on the testing. And together with the company, Aarhus municipality will decide on the framework and the scope of the testing. But if your company has an already available product, or that you would like to showcase or introduce to the Aarhus municipality, we have some other options, and one of those is exhibiting your product at DocX, which is Aarhus municipality's showroom of welfare technology. The next presenter, Mikkel Svendt Fransgaard, will tell you more about DocX. He will also tell you more about careware. That's another option if you have an already available or commercially available product to present it on what we call a careware presentation day. We have created this one entry point to ensure that the supplier is and the company is registered and that the inquiry is sure to be processed, to make sure that the possibilities in Aarhus municipality are made visible and that actions are taken. This ensures equal and fair treatment of the suppliers. And the idea is that this uniform process should create efficiency and optimization of resources. But however, in practice, this is obviously not always so simple. Companies often tend to contact department heads, or maybe they contact health and care staff. Maybe they already have previous contacts, or maybe they know someone working in the municipality. And this is obviously very understandable. But we ask that everyone is directed towards this single entry point. Also, it's not always very clear what to do with the inquiry, unless we as a municipality are actually looking for specific solutions to specific needs that we have identified. It's actually quite difficult to assess the potential of a new solution. So the process can be quite lengthy. It can take a lot of time to really look into a new solution and assess if we have the need for this solution. Often this is unfortunately time and resources that we don't have. So this is something that I think as a company, companies have to be aware of as well. Next slide, please. Thank you. So some key points to remember if you are interested in collaborating, not just with Aarhus municipality, but I'm pretty sure I speak for all 98 Danish municipalities. There are some speaking from experience, there are some challenges that we are hoping through, for example, this Nordic Access project to improve on, and some of these are that, for example, agreeing on terms and conditions of a collaboration is actually quite often challenging. What will each partner bring to the table? This is very important that both us as a municipality, but also you as a company is very clear on this, expressing what you expect to gain from for example, a testing. So yeah, it's important that expectations are aligned. Sometimes we get in contact with companies that expect that us to be willing to pay to test a company product. This is rarely the case, because the municipality already puts in a lot of time and resources on the actual testing. And our health and care staff are extremely busy as it is, and often find it difficult to actually find time to learn to use new technologies and test these technologies. And I'm sure you know that testing and implementing is rarely a smooth process, and often it takes a lot of trial and error. Also, we encourage companies to be very open about any shortcomings or limitations of their solutions, features that have not that are expected to be fully developed but are not yet fully developed, as these as we've often experienced that if something is missing, or expectations that we had of the product turns out not to be to live up to the expectations, then this leads to delays or sometimes even terminations of tests without any usable results to either partner. So if the municipality requests specific functions and the product cannot live up to these or provide these certain functions, then this is something that should be this is information that should be shared. So basically, transparency is key, and both parties will definitely benefit from this. So also the municipality, sometimes we as a municipality, we know, again, this is something other municipalities have as well. We might have identified some specific needs, and we may be interested in a specific company product, but we would like a few amendments to the product. So entering into dialogue with the municipality about being willing to, about the willingness to adapt to these needs and adapting the solution to these needs is something we very much appreciate. Then we often hear that working with the municipality is a very slow process, and yes, that is definitely true. Municipal procedures are lengthy and have to go through many layers of management, so I can only say please be patient with us. And then the understanding, another really important thing is that understanding the Danish market. If you want to enter the Danish market, it's key. Well, understanding any market, of course, is key, but when we're talking about the Danish market, it's very important to get acquainted with the legislation surrounding assisted living technologies and assisted living aids, because in Denmark, technologies and aids have to meet certain legislative requirements in order to be granted by the municipality to the citizens for free. If they do not live up to these legislative requirements, then the citizens will have to pay themselves, and then you might find you have a much smaller market. And please change to the next and final slide, please. Thank you. This is just to give you an example of a case that or a collaboration which is ongoing as we speak. Back in October, a company that makes, I'm not sure if this is the right translation into English, but tilt systems. I'm sure the picture will explain to you what I'm talking about. An assistive device often built into the bed that will help people turn over in bed. So they went through our single entry point, and when the panel received the inquiry, they knew that there was already a test with 3 other similar systems going on, which we're looking at there was a new project just started that had the purpose to prevent pressure sores, and so therefore being approached by this extra company was quite interesting to us, because we had already identified a need. This new product did actually not have all the functions that we were looking for. So but they were very interested in developing them. So therefore, the company has, together with the municipal staff during the testing, they have created an application for a corporation that will develop and test the product. The application has been sent to a municipal fund that we have that covers the entire municipality. It's called the Public-Private Innovation Fund. This fund will fund public-private cooperation that work with assistive living technology. So this is an example of where we actually had that we were approached by a company that had a product that fit a need that we had already identified. And then the willingness of the company to adapt to our needs creates basically a win-win situation. The company could develop their product and use the setting, the sort of living lab setting in Aarhus Municipality to test and develop their product, and well, Aarhus Municipality obviously get to test various systems, and probably in the end will end up making we'll have a procurement when we have decided on what we exactly we need to aid this problem we have with pressure source in our nursing homes. Well, that was basically it from me. Thank you very much, and then I'll pass on to you, Mikkel. I think you're next in line.
Yeah. Thank you, Anna-Karin. I hope you all can hear me. And I'll make sure to leave some room to Kent after this presentation. But yeah, my name is Mikkel Svend Franskott. I'm a project manager and technology consultant at the two places I will be presenting about, as Anna-Karin mentioned. One is DocX, which is our interactive exhibition, and then we have Careware, which is kind of a knowledge and a conference and webinar platform. But these are some of the ways that we are in AARHUS are innovating together with companies and are trying to create also an innovative ecosystems together with the companies, our citizens, and especially also our employees. Next slide, please. Yeah, and I kind of been through some of these numbers. I think for this, I will just actually highlight that more people, as many of you probably know, will live longer with a chronic disease in the future and have shorter durations in the hospital. At least that will be the case in Denmark in the future. We are also facing large difficulties recruiting new personnel in especially our nursing homes and for home care. And that will set an increasing demand for treatment in people's own home, and will also need people actually to be more self-reliant in the future. And one of the solutions we in AARHUS see to that issue is welfare technology or assistive technology. Yeah, next slide. So firstly, I'll just present about DocX. DocX is an interactive exhibition about welfare technology. We invite the citizens, their relatives and employees in to get advice and guidance on which technologies that exists and how they can use these and how it might be able actually to support an independent and active lifestyle, or it might support a healthy living environment or working environment for our employees. We also invite a lot of educational institutions and research institutions, as well as business and industry. And we do events and workshops, but we're also very reliant on many of the companies that are exhibiting in our exhibition. And I will come a bit back to that and how we work around that. But first, I'll just present a few of the pillars that we are working with at DocX. Next slide. So the first one is empowerment. In Denmark, the municipalities are actually obliged to fulfill this service act of delivering information about what is existing and what the citizens can get in terms of technology for their everyday life. And DocX is one answer to that in AARHUS. We also have other answers, but that is one of the many solutions we have to this. Next slide. DocX also, we are trying to actually demystify this technology. We are trying also to showcase to, especially for example, elderly citizens, that technology can actually be a way to maybe free yourselves of some difficulties that you may have, and that can be assistive devices. But it is also to demystify this technology towards our employees, that they can actually see the benefits. They can come and they can experience the technology physically, have it in their hands and try it out. That is what you can do in DocX, and that is a way we try to demystify the wrong ideas that might be around using technologies for different purposes. Next slide. Yeah, Then we also have in Aarhus a cross-jurisdictional vision for using welfare technology that goes into the future, and DocX is a large part of that. Also to include a lot of partners into our vision towards using more welfare technology in the future. We will not be able to do that on our own. We need companies, we need citizens also to get involved. We need organizations that can help us with this. So DocX is also a place where we try to collect all of these partners. Next slide. Yeah, then we are also a place of a lot of knowledge. You will actually be able to find this, a lot of it on our webpage. Some of it will also actually be in English. But yeah, DocX has also set out to be a environment for product development and user testing, and be able actually to contribute to an innovative environment within health and care in Aarhus. So we actually want people to come down to DocX at events or just by visiting us and be part of the innovation. And also allow maybe the companies to get some feedback on their products, especially newer products to the market, can not be physically tested, but they can definitely get a lot of feedback from both their end users or the secondary end users down DocX. Yeah, next slide. And this is just to showcase who our visitors. So we have had just a bit over 75,000 since 2016. Of course, we had 2 years of almost 2 years of pause, not that long ago. But the main people that we see down here are the citizens, and it is also our main target group. The secondary one is the professionals. So the healthcare professionals or other professionals within the municipality getting inspired about using technology for the municipality's services. And the third ones are the students, and we are very interested in students and the educational institutions, actually both working within healthcare but also working with engineering or designing. We have collaborations with all of those types of students, but they will definitely be the ones to kind of shape the future, and therefore we need them involved. Next slide. Yes, so very shortly, we have 2 exhibitions each year under different themes, and in each exhibition we include new solutions. So we invite in, or companies apply, and then under a specific theme we put up a new exhibitions. So we had 15 different exhibitions since 2016, and that have made 480 different exhibiting companies that we have collaborated with across 912 different products. So we changed it up also because there is so much development within this area, and there's also many themes and viewpoints. Next slide. Yes, lastly, I'll just present also our knowledge platform. I've decided to call it that, which is called Carer, and it's actually a Nordic platform for healthcare professionals and companies. And we host different events, and Akarin just mentioned the presentation day where we invite companies to pitch under a certain theme. Just today we had a presentation day about welfare technology for the census, which was very popular. Then we host a few master classes during the year about specific themes where we invite experts. Then we have springboards and expert panels, which is really for companies to actually, the springboards are where we invite a board to give some feedback on their specific product, and the expert panel, we kind of do a small test of the specific product and deliver some information back to the companies. Then we also have physical conferences, and the presentation days are virtual days mostly. But you can read more about this on careware.dk. Next slide. Yeah, that was it for me. As I said, my name is Mikkel Svend Franskov. You are welcome to give me an email if you want a bit of elaboration on some of the things I presented here, I'm very would be very glad to do that. So yeah, don't hesitate to contact me. Thank you, and I will send the torch towards Kent.
Thank you, Mikkel. I'm just going to focus on one slide. If you look into the digital arena of Sweden, and if you look into Region Västerbotten and northern part of Sweden, there's a lot of things happening right now. That's why the middle picture is here, just launched. I didn't find any English translation on the left-hand side here, but I'm going to talk you through it briefly. Digital Impact North is basically a new initiative founded by the university up here and the region together with Research Institute of Sweden. And why are they doing this then? Well, the vision behind all of this is to create one of the leading regions in the world in terms of strategic digitalization and smart sustainable society. There's a lot of happening right now within the Swedish area with regards to companies and such, and they're focusing a lot up here in the northernmost part of Sweden with both IT, telecoms, AI, community planning, and it's happening as of now. What will this have to do anything with Nordic Access? Well, on the right-hand side, you have this new initiative. We are established as one of the European health initiative hubs up here. And it's about getting SMEs into the world, helping them find the right testing partners, helping them to find access to the public sector, to private sector using key technologies. Because AI is on the march. I'm not sure if you read the news lately, but if you look at the tech companies in Silicon Valley, they're having kind of a rally right now with regards to AI is really coming. It is really coming. And just not, and to basically understand it more, if I look into the university up here, we have investments in AI research right now of 10 million euros annually. And it's all about getting things out to the market. And Health Data Sweden is basically one of the key initiatives. It exists in Finland as well. Then it's called Health Finland, I think. You can correct me if I'm wrong here. But it's all about finding the solutions for how to implement or help companies gain accessibility to the market. It's not just skills and training, but it's also access to finance. It's all about access to innovation ecosystem and networks. It's all about what we are basically working for, test before invest. How can we find a solution? How can we mitigate? How can we use our funnel to help SMEs find the right testing partner? How can we find the best solution for both parties, not just SME coming into the market, but also for, from my perspective, the region to find the best solution of our problems and our needs and mitigate that. But at the end of the day, it's all about health data development. There's a lot of things happening in that area, and the transformation from having the health data stored in the hospitals and such, and getting them to you, in that we can improve and enhance our behavior, getting healthier, live longer, and have a better life. So right now, there's a lot of things up here that it's basically just being launched, but it's not a new dawn coming to us. We have participation in 4 Horizon 2020 projects in the health data area right now. We're participating with the Research Institute of Sweden, a lot of projects, and also with Vinnova, that's the Swedish government's innovation agency, where we, as of today, have 15 million euros in ongoing projects to transform. So the northern part of Sweden is kind of far from many out there in the market, but things are really, really, really happening up here. So welcome. So I'll leave the marker back to Rosa, I think, or who's taking the lead after this?
Thank you very much, Kent. I would like to remind everyone that now we have like a little break. In case you have any questions, please feel free. You have still 4 minutes to ask any questions, either leave them on the chat or ask any of the speakers right now. Otherwise, in 4 minutes, you should be going to the B2B meetings. And in case you haven't booked any, feel free to book them now, because we have still some spots. So feel free to book them now in case you want to speak with any of the speakers or any of the participants. If there are no questions, I would like to thank everyone for taking part in, and please feel free to join now the B2B meetings. I will leave the chat open for the next 2 minutes in case there are questions. Otherwise, enjoy your B2B meetings. And if you have any questions in the next days, please feel free to contact any of us. Guess there are no more questions. So thank you very much, all of you. Then enjoy your B2B meetings now. Ciao, and thanks again.